today's video, we will discuss about supplementation of calcium and vitamin D, especially in relation with osteoporosis. We all know that these two supplements are the most commonly used. In fact, we can say most commonly misused supplements without actual assessment of their deficiency. In today's video, we will see what should be the actual daily intake and how to assess it, and when there is deficiency, how to supplement pharmacologically as well as some non-pharmacological supplements in diet. First thing, as I mentioned, assess the initial intake of that particular individual. And here we have to remember few of the numbers. In general, for adults, just remember 1000 number. That is, daily calcium intake should be 1000 milligram per day. And vitamin D, roughly we can say 1000 international units per day. So if you remember this number, you can assess the daily intake by asking few of the dietary habits. And one more numericals which we have to remember is the normal levels of vitamin D. It should be more than 30. So related to osteoporosis per se, there are few things which we have to advise to the patients to take, and there are few things which they have to avoid. Also, there are some lifestyle related things which they have to practice regularly. For example, in intake, calcium, as I mentioned, should be minimum 1000 milligram per day they have to take, and in postmenopausal women, it will be little bit more. Whereas vitamin D, again, remember the number 1000 international units per day. What they have to avoid is alcohol intake, and caffeine intake should be limited to less than 2 servings per day. Whereas regular aerobic exercise as well as resistance training is very important in relation to bone health. Avoid smoking, and as much as possible they have to prevent falls. So these are the general guidance for osteoporosis patients. Now, I mentioned we have to assess the daily calcium intake in every individual which we have planned to treat. For example, in general, whatever food we will consume, we will get minimum of 300 milligram from the non-dairy sources. For example, some millets, seeds, some of the vegetables, especially ragi vegetables, drumsticks we can consider. So these are some of the sources which in daily intake will provide up to 300 milligrams of calcium. Whereas if the individual takes dairy products, for example, 1 cup of milk will give minimum of 300 milligram of calcium. Like that, we have to ask the history and we should assess. So this will give the overall daily dietary calcium. So the combination of all these should provide minimum of 1000 to 1500 milligrams per day. So if they are not able to reach this particular level, we need to supplement pharmacologically. So this step is done. We have assessed the calcium intake and the everyday relative deficiency. Now we have to supplement calcium. There are multiple options available. Commonly, we can go ahead with calcium carbonate or calcium citrate. So the difference is also very important because, see, for example, calcium carbonate is gastric acid dependent. So it needs gastric acid for the better absorption. Many individuals will be taking anti-acid medications, or they might be having achlorhydria. In that case, absorption will be significantly reduced. So in such situations, we can utilize calcium citrate, which is less dependent on gastric acid for the absorption. And another advantage is this is also helpful for those who are having kidney stones. So there are two advantages of calcium citrate compared to calcium carbonate, and these supplements should be given with meals always. Coming to the assessment of vitamin D, remember there are some of the dietary sources, for example fish, fortified milk, and some of the cereal products which will give moderate amount of daily vitamin D. Also, we know sun exposure, that is minimum of 10 minutes between 10 a.m. to 2 p.m. is the ideal time. Minimum 3 days per week is advisable for adequate vitamin D production. But we all know that there are numerous factors which will act as barriers for the natural production of vitamin D. For example, usage of sunscreens, or in dark skinned individuals, there will be lesser production of vitamin D. and in elders. So these are some factors which will act as barriers. So in that case, we need to supplement with vitamin D on daily basis. This is the assessment of daily vitamin D. So based on this, we will decide and we will get the serum levels if there are any clues of vitamin D deficiency. We all know that this particular vitamin, if it is deficient, will result in the manifestation in almost every system of our body. Starting from musculoskeletal system, it can even affect diabetes and mood related disorders as well. So get the serum levels of vitamin D. I have mentioned in the first slide, it should be more than 30. So when we get the reports, how we have to assess it and how to treat. Remember, if the levels fall between 20 to 30, consider it as mild deficiency. Moderate if it is between 10 to 20, and severe deficiency if there is less than 10. Because the treatment protocol will differ. Generally, people will supplement with the loading dose with some random numbers, which is not ideal for all the different levels of vitamin D deficiency. That's why remember to divide according to the severity, then follow the protocol. For example, if there is mild deficiency, just supplement with 2000 units every day. Whereas in case of moderate deficiency, first the general practice of loading dose, that is 50 or 60,000 international units of vitamin D should be given weekly for 6 to 8 weeks. Then we have to keep on giving maintenance dose of 2000 units every day. In case of severe deficiency, remember to give the same loading dose but twice weekly for up to 3 months. Then without fail, we have to give the maintenance dose. So this slide is very important to treat vitamin D deficiency adequately without following some random numbers. And in some special populations, for example, individuals with malabsorption syndromes or severe liver disease, if they are obese, in such cases, we need to go ahead with alternatives. For example, we can prefer calcitriol. Here, one important point all of us should be knowing, that is, whatever the general supplement forms will come for vitamin D will be the precursor forms. For example, cholecalciferol forms will be available. But this will need activation from liver, then from the kidneys. Once it is being activated in the liver, which we can consider as calcidiol, this is the form which we commonly measure in serum. So the measurement is of the levels which are there in the liver, whereas the general supplements is a precursor form. What about the final product? That is nothing but calcitriol. So this is the final activated form. So where we have to prefer the usual supplement and where we have to prefer the already activated calcitriol form is very important. Individuals who are having liver disease or chronic kidney disease, where the precursor form is not being activated properly, so in them supplementing with the usual cholecalciferol form is useless. So in that case, we have to directly supplement with the active form of vitamin D, that is calcitriol. Why in general population will not directly give with this form is because this has a very narrow therapeutic window, in the sense it can directly lead to renal toxicity, leading to abnormal calcification in various vasculatures. So we need to monitor its levels very vigilantly. That's why we will not utilize this particular form in general cases. Whereas if we supplement cholecalciferol, which we generally do, this will be directed to the kidneys, and kidneys will regulate how much ever is required. They will produce, they will activate from it. Whatever is not required for the body will be excreted. So this will be properly regulated and there will be minimum renal toxicity with this form. So this difference we have to know whenever we are treating vitamin D deficiency, especially in population with CKD. You have to remember this. Finally, when it comes to the safety related to supplements, previously it is claimed that these supplements will promote abnormal calcification leading to cardiovascular events. But in large reviews and meta-analysis, it is being demonstrated that this is not the scene in all population. If we supplement in the recommended dosage, it will not lead to increased risk of abnormal calcification. But again, remember, it should be according to the recommendations, not some random supplementation. Otherwise, definitely it will lead to abnormal calcifications in the vessels, leading to cerebral and cardiac events, as well as there will be high risk of renal toxicity and formation of renal stones. So always know the protocols, then only supplement these calcium and vitamin D. Hope you have understood this commonest clinical concept. So save this information and share it among your colleagues. Also, don't forget to subscribe our channel so that we can come up with such informative videos which will be helpful in daily clinical practice. Thank you.